Good evening, everyone. Dr. Twining, live from Apollo Cardiology here in St. Louis, Missouri. So, just wrapping up building some bookcases and some other fun stuff tonight. So, doing a Q&A for September. Ask me anything. We have a few live questions that got submitted, and if anybody logs on, I'll answer yours as well. So, give it a minute for some people to log on here. Painted the walls. There's a couple little touch-up spots left, but otherwise we're good to go. Good evening, good evening. All right, we flip the camera around here and we'll get live. So, all right, so welcome back to Apollo Cardiology. This is the new location here in St. Louis. So we've got the purple wall to signify UV from the sun, as well as my favorite color. So tonight can answer a few of your questions. If you have any, just drop them in the comments. So let's get to it. So let's see, where did the questions go? All right, here's the first question. What is cardiomyopathy, and what is the best way to manage it? So if you break down the word, cardio tends to relate to the cardiovascular system, the heart, and then myopathy is weak muscles. So cardiomyopathy is a weak heart muscle. So many causes of cardiomyopathy. There's ischemic cardiomyopathy is the number one indication or reason. So meaning you have one of your coronary arteries not providing enough blood flow to the muscle itself, and it doesn't squeeze well. Or there's dilated cardiomyopathies, there's certain congenital abnormalities, there's amyloid, there's alcoholic cardiomyopathy. So there's multiple reasons why the heart muscle gets weakened, and the job of your cardiologist is to figure out what is the root cause of that and try to mitigate the downstream effects from it. The best way to manage it is finding what causes it and then fixing that. It's an issue with the mitochondria, the organelles in your cells not providing enough energy. So it's like a brownout to that territory. So not enough energy, things don't work as well. So got to figure out what's breaking it and then fix it. All right. So next question. How can a new mom optimize her sleep with multiple nighttime awakenings to feed the baby? So evolutionary, this is going to be challenging, but this is what you are kind of built to do. And it's not something that you're going to be doing the rest of your life. I think one of the whales also somewhat does this, that they'll short sleep themselves for a little while to make sure that the baby gets back to the herd, but otherwise most animals don't short sleep themselves on purpose. So when not knowing your full context, your circadian rhythms are still very important. So you want to do your best you can to kind of continue to have your light environments optimized and then your nutrition optimized from a timing standpoint to the best of your ability. So from a nutrition standpoint for yourself, ideally just try to stop eating 3 to 4 hours before your natural bedtime would have been. And then the most important thing would be your light environments. Yes, it's going to be challenging, with the up and down in the middle of the night, but ideally you would still see at least 20 minutes of the sunrise. Even if you have to go back to bed and take a nap to catch up on your sleep from the night before. It's that morning light that sets your supracosmic nucleus and helps set your hormone cycle for the rest of the day. And then when you're kind of getting up in the middle of the night to feed the baby, wear some type of blue blocking lenses so that you're not getting the signal to your brain that it's still daytime. So throw on a pair of red tinted blue blocking glasses, do what you need to do for the baby, and then try to get back to sleep. That would be my recommendations for that one. Next one, when helping loved ones get healthy, where do you start? So it's a great question. First lead by example. So show them how it's done. That's the key. So honestly, I would start again with the light environment. So teach them that sunrises are extremely important for your circadian clock. Minimizing artificial light, especially at nighttime, is key. And then it's the kind of the four-legged stool. So yes, nutrition, exercise are important, but you got to help people learn how to manage their stress and then ideally manage their sleep. So if you only had to start with one place, start with their light environment, but really focus on making sure they're getting high quality sleep, because that's when your body needs to repair itself. All right. And I'll post this one in case anybody knows how to interpret this. I wasn't able to copy this and put it into Google Translate, so this obviously looks like it's Russian. If anybody knows what that is, send it to me in the DM, and I'll try to answer it next time. All right, got another one here. And I'm not trying to interpret this one, but it says, please comment on Sundays causing cataracts. So I don't think any particular day causes cataracts, so I would read into this that, comment on how much does the sun influence cataracts. So it typically is going to be an unbalanced wavelength of light that's going to worsen cataracts, and it's generally more blue spectrum of light than anything. Yes, if you had tons of UV unfiltered, that would also potentially cause it. So anything that your body's doing to try to filter out getting all that high intensity light into the back of the retina, your eyes are going to cloud up, or the lens should cloud up, causing a cataract. But cataracts are worsening the more time people are using their blue lit black screen devices. All right, so I think those are the pre-populated questions. We got a few other people joining. Thank you for joining. I see Bradley on here. So yeah, we got our gargantuan red light panel coming soon. A little bit of a hiccup with delivery today, but I'll let you guys know when that's up and running here at Apollo. So question from a patient. So why do heart attacks increase in postmenopausal women? So the data is typically showing that women develop heart disease about 10 years on average later than men do. And the reason that they're generally protected for a long period of time is estrogen is cardioprotective. It has an effect on the LDL receptors. And so post-menopause, when your estrogen levels drop, you don't have as many LDL receptors. You have more, cars on the highway, more boats in the waterways, however you like the analogy. And if you have inflammation on top of that, then you kind of set the milieu to start laying down more plaque in the arteries. So, I usually tell my women patients, yes, breast cancer is something you need to be monitored for and work with your doctors to make sure you're up on your screening. But the last time I looked at the data, it was about 1 in 8 women with breast cancer, but it's 1 in 2 to 1 in 3 women with heart disease. So, if you're getting your breast cancer screenings routinely, you also test not guess and make sure your heart is as healthy as you expect. And typically the test I recommend for that for people who haven't already had it, typically women over 40, would be a CT coronary calcium score test. It's a low-dose radiation CT scan. Tells you if you have plaque building up in your arteries, yes or no. Now, if you're already somebody who's had a stent, bypass surgery, or stroke, you don't need that scan. You're already high risk. But for people who want to know what the risk is, that's the best non-invasive scan to take a look at. And then I got a question. I'm not an expert in this part, but how does COVID and the vaccine cause myocarditis? It's most likely the spike protein directly causing endothelial dysfunction, the endothelium being the inner lining of your blood vessels. You got 60,000 miles of blood vessels, and so if the spike protein damages the glycocalyx coating the endothelium, the endothelium doesn't release nitric oxide. Nitric oxide acts like Teflon, prevents stuff from sticking to that. If you have poor endothelial function, then your immune system tends to get activated in that region, and it's not necessarily an autoimmune condition, but your cytokines and the rest of your immune system's activated, and you start bringing different immune modulators to the territory, and then the heart tissue is kind of a bystander at that point. There's a question coming in. Do I recommend oral probiotics? Is there a link between oral health and heart health? So answer the second one first. Definitely there's a connection. There's a symbiotic relationship between the bacteria in your saliva and your endothelium. So you frequently hear me talking about nitric oxide. So nitric oxide is made in a couple different pathways, but after the age of 40, the oral pathway tends to dominate. So when you eat your green leafy vegetables and beets, the bacteria in your saliva help break that stuff down into nitrates. You swallow that in your saliva. And this is why if you see me in the office, I'm asking you if you're taking any type of acid-blocking medicines, because the acid-blocking medicines have an effect on the stomach's ability to convert that nitrates into nitric oxide. So you need healthy bacteria in your saliva, and you need healthy acid levels in your stomach to make nitric oxide out of your food stuff. So yes, if you have an infected tooth, periodontal disease or gum disease, and you're inflamed because of that, your arteries will potentially get damaged as well. And then I know there's some trials that I've done in the past where there's oral pathogens found in coronary plaque. So they may not be the only thing driving vascular risk, but in some studies it shows that when a plaque ruptures and they basically send it down to pathology, not uncommonly there's some bacteria that are oral in nature inside the plaque that ruptures. Now I don't particularly recommend any type of oral probiotic. I would kind of defer to your oral health provider if they think that is warranted. But my big caveat would be, be very careful and ideally avoid, mouthwashes, especially the very nuclear options where it destroys all the bacteria in your saliva. It's fine to brush your teeth, floss, but you don't want to go nuclear and kill all the good bacteria in your saliva. All right. Let's see. I think I got all the pre-written questions. I think I'm up on all the live questions. So we're waiting for any other ones to come in. Apollo Cardiology is up and running. We're doing our carotid intimal medial thickness scans here. We're doing the test that says, you're basically, if you have soft plaque in your carotid arteries, what is your arterial age? It's a good metric if your arteries are aging appropriately. Also doing the endopat test here that looks at nitric oxide levels. So more nitric oxide levels coming from your vascular system, the healthier arteries tend to be. We do pulse wave analysis, heart rate variability, metrics of how elastic the arteries are. And then in the very near future, we're going to have some more options to actually treat the mitochondria a little bit better. So we got a couple photobiomodulation panels or red light panels here, but our big beast one's supposed to be delivered in the near future. You can get whole body photobiomodulation, in just a few minutes with this bad boy. And if you're in the St. Louis region and you're, basically in the south looking towards Richmond Heights, you should be able to see this building when I light this thing up. All right. And so that's the updates from Apollo. Next week, I'll be on Monday, 6 p.m. usual time, Central. I'll be doing a talk on, I'll just do it on nitric oxide, endothelial health. We'll talk about the glycocalyx. That glycocalyx is basically the coating of the endothelium. And the healthier glycocalyx, the less likely you're going to develop plaque in the arteries in the first place. So we'll talk about that. Things to do to test your endothelial function, and some options you can do from a lifestyle standpoint that can improve your nitric oxide production. In future, I got a couple guest speakers lined up. We're going to be talking about hormone replacement therapy. We'll do two different ways. One will be talking about testosterone replacement therapy in men. That'll be one topic. And the second topic will be about hormone replacement therapy via the pellet method in men and women, pros and cons. So I appreciate your guys' attention tonight. I hope you guys had a good Labor Day. I'm going to wind up finishing this bookcase and get home. And then I'll see you guys on Instagram this week. If you need anything in the interim, just shoot me a message on Instagram through a DM, or you can check out our new website, just apollocardiology.com or drdwyman.com. Have a great week, guys, and we'll see you next time.